Rob, the GP at the centre of the novel, and his old friend Stephen are chatting after their regular game of squash. Cleaning was of course one of the first things that they privatised about 30 years ago. It's been a disaster. Bring back the ward sister, that's what I say. Then the individual ward was under her authority and she had responsibility for everything that happened. This included the cleaning. The cleaners were attached to the ward, trained by the ward sister, were part of the team and took a pride in their works. They chatted to the patients. You were right, it worked. But idiot politicians have egos and personality disorders that make them want to change things. They don't understand that if it ain't broke, don't fix it idiom. Their stupid motto is, no change is not an option. Yes, it is a bloody option and often the best. Prats. Look at that cock-up the Dangerous Dogs Act was. A completely useless law brought in as a knee-jerk reaction. Legislate in haste, repent at leisure. I'm waiting for them to ban all sandwiches because one poor sod choked on his BLT. A bacteriologist looked at the effects of all this crap on infection rates. Yes, the instance of the health secretary got his knickers in a twist about Clostridium difficile and MRSA, they did indeed fall, but other ward infections showed no change. And C. diff at home was rising. There must have been a load of white coats loitering in the bushes ready to pounce. Remember all those so-called antibacterial gels at hospital entrances? They made you feel antisocial if you didn't use them, though they did bugger all. Certainly didn't kill off C. diff. Who had shares in them? And surprise, surprise, they're not there now. Advertising bullshit, added Rob. Some claim to kill 99% of household germs. Considering organisms live in communities of 100 billion, that still leaves a billion.